Good day, good and gentle people. This is In Sickness and in Health Storytelling, Week 10. A New Old Paradigm. Paradigm first appeared in English in the 15th century, meaning an example or pattern, and it still bears much of this meaning today. For nearly 400 years, paradigm has also been applied to the patterns of inflection that are used with certain verbs or nouns or other parts of speech of a language into groups that are easily studied. So since the 1960s, paradigm has been used in science to refer to the theoretical framework, as when a Nobel laureate David Baltimore cited the work of two colleagues that said, really established a new paradigm of our understanding for the causation of cancer. Thereafter, researchers in many fields, including sociology, literary criticism, often saw themselves as working in or trying to break out of paradigms. Applications of the terms in other contexts shows that it can be used loosely to mean a prevailing view of things. That was from the free dictionary that you can find on the internet. Certainly, Hippocrates was setting a new example for what medical practice should be all those centuries ago. He did break new ground, and he did challenge other physicians of his time. Put to a vote, Hippocrates' ideas on how a provider should care for patients might not have made it out of Congress. As we have seen, Western medicine was imbued with the do no harm aspects of his oath that are still spoken at medical school graduations worldwide. Yet, we know that medicine is not nearly as idealistic as Hippocrates would have hoped. Secrets, intended or otherwise, abound. Sins of omission is how I have described it over the years. Patients may not tell a provider everything, like how their private parts came to be found in such an interesting predicament, or the fact that they did not take all those antibiotics last time and they started taking the leftovers 5 days ago for their cold and they don't know why they're not working, or omitting or denying the use of tobacco, alcohol, or illegal drugs that can and does change the care plan. We all do it. On the provider side, I am guilty as charged. I modified my language with almost every encounter I probably ever had, sometimes quite consciously. Lots of things drove that: to simplify for the patient, don't scare the patient, to sell my point, I was right after all, to convince them to do as I thought was appropriate, to counsel, to get them to focus, to not be too confusing. And the real kicker is that sometimes I did not have a clue. I did honestly try to educate people about strep throat infections, antibiotics, and the 1% of people who might get a kidney infection or heart damage due to the toxins. I did try to talk many mothers and fathers out of antibiotics for ear infections. I did try to explain why an x-ray was needed or not needed, as the case may be. I did try, at least most of the time, to inform patients of their choices. But there were many times when the sin of omission was the norm. It is easier for everyone, right? Some secrets have been so detrimental over the years and in the face of history. The ones we've talked about, the Tuskegee Institute, and the men who received no real care for their syphilis. The millions of people worldwide, not just in Germany, but in other places, that have been exterminated in the name of science. This is otherwise known as genocide. And the fact that we know that smallpox virus, which is now gone from the world, there is no naturally occurring smallpox virus anymore, that has been stolen from the repositories of scientific study, and we know is being weaponized and could return to the population with devastating effects. Secrets protect, but they also build walls. They separate, keeping the two sides apart. And the two sides are defined in many different ways. Us and them, the provider and the patient, the science of medicine versus the art of medicine, the technology versus the human factor, listening but not hearing, speaking and not saying anything. It truly defies comprehension on how much we miss because we have secrets. The new old paradigm. How do we as a society and in our individual communities get back to the ideals of Hippocrates? Back to the sanctity of life for all people, no matter the finances, their social status, their insurance card, or whatever. How do we get back to that? Well, you, as students, are taking a big step in that direction now, because education is a huge part of our ability to think, reason, make logical, heartfelt decisions. You have to have knowledge. Now you know that the body is an amazing set of interlocked feedback loops that allow us to hear and see and speak and move and dream all at the same time, while our liver and kidneys and digestive tract extract, clean, use, and filter, and our blood circulates to every one of the billions of cells in our body, all at the same time, with no conscious thought on our part. It's been said that if we, our brain, had to think of all the things that need to happen in the human body, minute to minute, to make it go properly, that we would be dead in 2 minutes. I think it's much more like 30 seconds, but suffice to say, the body is an amazing, amazing creation. We know that medicine is not infallible. Far from it. And while good intentions seem to drive the pursuit of caring for people in need, we know that technology, money, X-rays, tests, and science displace the deep need that we all have for sanctity, respect, healing, and compassion. We know now that there are organisms on the earth right now that can easily overcome our lack of knowledge, our technology, our everything, and cause havoc across the world, literally tumbling economies, decimating populations, and our technology. And we can't even see them or say most of their names most of the time. Knowledge is power. Power can help direct the practice of medicine back to its roots, perhaps. Because knowledge is power can be used against us as much as it can be used for us. It takes well thought, considerate human beings who want to be treated as they wish to be treated to make smart decisions, to do no harm. Go forth and study hard.